I started saying you once a week. And I remember I would like lie in the room and I would get these little senses of like, you're where you're supposed to be. And it brought me like such calm and joy. Also too, I would see people come in and I would hear their stories and it just gave me a sense of hope that I didn't have.
Sarah, we're here. And who would have thought we would make it to this
Not
part?
me, Danica.
Right?
Not me. You always had hope and I did not.
That's true. But that's, that was my job on the team.
Oh.
And the team was pretty big.
Yes.
Right?
At one point, my husband was like, how many different healers do we have on payroll? And I laughed and I said, 3, I think.
Jack, he's so funny.
Yes.
Okay, so I have with me Sarah Adina, a writer and producer and new mom.
Yes.
Who really has been through a lot.
Yes.
We met. Would you like to share the story? Because your version is going to be more exciting.
Oh my gosh. Well, when I started to, my husband and I got married in 2019, and I got pregnant within the first 6 weeks after our marriage. And I had a chemical pregnancy, so immediately miscarried. A month and a half later, I got pregnant again. At 6 weeks, miscarried again. And then a friend of mine was like, you should probably immediately go. At this point, I was 38 years old. And so I had a friend who was like, okay, you've had 2 miscarriages back to back. You should go to a fertility doctor. So I went to Dr. Kelly Beck, who is a genius. And I tell everyone I know, if you want a baby, go to her. And I went to her and, she started looking at my body and it was so methodical and scientific, and I wanted a baby right away. So I was like, this is taking so long. Like, I need to get pregnant. Like, where's this baby?
Wait, can I stop you?
Yes, of course.
What do you think was driving that this has to happen immediately? Because now we're going to have that 2020 hindsight.
Yes.
And the reason that you're here is because as we relive your story, the listeners will learn because we can really get into the hype of hearing your story. But I'm good at interrupting, be like, wait a minute, what is it? Why can't we trust that it's going to happen? Or what makes us have that insatiable need and like pressurized?
I don't know if it was society or this idea in my head that I always wanted to be a mother, but I don't think I even had really understood what that meant. I just thought, okay, I found my husband and I found, Jack and I met later in life. I was in a really long relationship prior to meeting Jack that was, I was working through all of my, I think, childhood trauma within that relationship. And then once I got out of that, I met Jack and it was just very easy and loving. And I told him from the get-go, I just want you to know, like, I'm definitely going to be a mom. Like, I want to be a mom and it's important to me. So if you don't want kids, by the time I met Jack, I think I was 36, almost 37. Like, I probably shouldn't engage longer in this relationship because I want to be a mom. And he was like, no, I know that about you. I want this too. Let's go forward. And I said to him, and don't worry, I'm not going to do like IVF or anything. Like, if it doesn't work, it doesn't work. Well, I was determined to make this work, and we'll get to the IVF later. But I just always thought like this is going to be part of my journey. Also, I had a lot of, I think, unprocessed grief that you and I, through our work together, really worked through. My dad died when I was 13. And in my head, I somehow thought that if I like had a child, it would bring him back in some way, which of course is so much pressure to put on an unborn kid. And once I realized that there's no bringing anyone back and you have to process that grief, it actually helped make my fertility journey a lot easier down the road. But we'll get there.
I do think too that we definitely ascribe meaning to goal attainment.
Yes.
To correct certain things that we feel like we missed out on, or we did something wrong, or something that to have a kid makes something from the past right.
Yes. And I think there was this like hole that my father's death left. And I thought, if I have a child, that will fill that hole, which of course is not accurate.
And it was really innocuous in the deep layers of your subconscious
Yes.
was where that lived, you would have never have presented and said, I lost my dad, and I think that if I have a kid, it's going to fix that.
Of course.
We had to,
And one thing that you know about me, I love psychics because my dad, he died when I was 13. He was only 39 of a sudden heart attack. So there was no warning, right? It was just suddenly he was there one day and that night he was gone. And so I became obsessed with people being able to tell me the future and trying to understand what was going to come to protect myself from any type of pain like I experienced when I was 13. So I had a psychic once tell me, and I've had I've had a therapist since say to me that I'm like an alcoholic who can't have a drink when it comes to psychics. Like I can't go see somebody because I was so obsessed with having to know the future. And I had the psychic tell me that I was going to give birth to the soul of my father, which it's funny because now that my daughter is here, she is not my dad. Like I can tell that within 20 days of her life, she is not my father. And that is okay. And I'm glad of that. But I became obsessed with this. I have to bring him back. It was just this like circle of life that I thought would somehow bring me some sort of closure to his death, which
starts when you're 13 years old. You're going to think illogical, irrational thoughts like that because the loss happened and probably really impacted your home.
Yes, very much so.
So as a kid, you want to fix things for your parents. I don't know what that is in psychology terms, but looking back now, we can see it different.
My gosh, completely. And I think when I like look back at my childhood, you know, I've had that sort of nuclear family, right? There's my mom, my dad, my brother. It's like that was what a family was supposed to look like. And so as an adult, I was like, okay, I'm going to then, you know, complete that sort of circle and have my own family. So I don't think I really understood what having a child was going to mean yet. I just knew that that was the next step in my journey. And then getting pregnant so quickly, I was like, great, this is all working out. Everything is perfect. And then the second I kept having these like chemical pregnancies and really early miscarriages, I was like, oh, I have to get help. I need to intervene because this has to happen quickly.
So then Kelly shows up and she wants to do
testing and understand my body. And I was on a schedule that in my head, like that I had come up with where I was like, this is taking a really long time. I need to move forward quicker. And the thing about Dr. Beck that it makes her so brilliant is she was like, I'm going to understand your body in order to like produce results because every body is different. And I was kind of like, nope, cookie cutter science. Like, let's just go. Like all my friends had done IVF at that point. They had done a round, they had gotten their embryos and they were pregnant within like 6 months. And so basically I met Kelly Beck probably right before 2020. And so March 2020, obviously the world shuts down. And this was right before I was going to potentially do my first sort of round of IVF with Dr. Beck. And then California Fertility Partners, because they are an accredited, wonderful place, shut down because it was a dangerous time to be attempting to create embryos and you know, conduct science in a responsible way. And so I went to a different clinic, which I jokingly said to Danica, if you ever want to know which one, you can slide into my DMs and I'll tell you, but I shouldn't speak ill publicly. I went to a different clinic that stayed open the entire time. And so I remember putting on my like hazmat suit. And back then when we were like afraid to like breathe the air of anyone else, I had like glasses, goggles, gloves, you know, plastic from head to toe. I was like carrying a jug of, it wasn't even Purell because we couldn't find Purell at the time. So it was like some like off-branded, you know,
sanitizer.
Antibacterial sanitizer that came in like a gel. I was like globbing it on. It was disgusting. And I went to this clinic and they just were like, okay, without ever really looking at my body, they were like, here's how we do it. Here are your drugs. We're going to shoot you up on this day, you know, come in with the first day of your period without even really looking at me or, you know, like examining me in any way to see how my follicles grow, to see, you know, how my body responds to medicine. Nothing. They didn't, I think they maybe checked my estrogen levels, and that was the extent of the scientific research they did on me. And then they did sort of that cookie cutter, one size fits all IVF cycle. And here's the thing. By that point, I'm 38 and a half, and I go through this this round of IVF, and my body never really responded that well to meds. I would usually start with anywhere between 12 to 10 or 10 to 12 follicles, and then they wouldn't grow. Like I wasn't, what do they call it? Like I wasn't stimming properly.
Yeah. And if this was during the quarantine, I want to tell the listeners that most women weren't stimming properly. There was a lot of stress and adrenaline in the nervous systems of all of us.
Yeah.
And the eggs, they respond to endorphins in a positive way.
Right.
Like they will grow when they feel like it's safe to do that.
Yes.
And if they pick up on adrenaline and cortisol, and they perceive that the environment is stressful, then they just pull back and decide that they're going to wait.
And boy, did they do that. And also too, I'll say that my husband lost his songwriting partner. He was this brilliant songwriter and musician named Adam Schlesinger, who died on April 1st, and he died of COVID. And it was pretty, it profoundly affected both of us, in particular, Jack, my husband, because they worked together for years on a TV show together. And also, too, it was, I will say that I had a lot of friends that were pregnant during 2020 at this time as well. So I was like watching other people have their babies, like give birth. And some of them, I had been pregnant at the same time as them. The first time I got pregnant was in August of 2019. And so come March and April, those like my friends who I got pregnant with at the same time, they were giving birth right at this time. And it just was a lot of emotions. It was like grief. I hate to say jealousy, because I never felt jealous of my friends who were giving birth. I just remember thinking like, why can't I do it too? I didn't want them to not have their children, or not, like, I was so happy for them.
I think we could call it just comparative thinking.
Yeah.
Yes. Like, how come it's not happening for me at the same time?
Right. And I think, Jack was also grieving the loss of his friend. And so to go and try and do IVF at this time, because we talk about the emotional component of IVF, it's so taxing. It's not just it's not just physically taxing, it's emotionally taxing. Like you pick up this needle and you shoot yourself up. And in your mind, you're like, I'm going to grow a baby. But then you're also putting in hormones and you feel crazy and you gain weight, and it just, you don't feel like yourself at all. And so you're trying to do this thing in a time when the world is completely shut down and grieving because so many people were dying. And so I did this round of IVF, and I think I got out 5 eggs, and only 1 fertilized. And they let it grow, and by the time I think it reached day 6, they were like, it hadn't reached blastocyst stage. And they called me and they were like, yeah, I don't know what to do here. And I was like, oh, okay, well, should we do another round? And the doctor called me and was like, I think you should just move on to egg donors. And I was like, I've done 1 round. Like, doesn't sometimes just take a little bit? And he's like, you didn't really stim properly, and we only got 1 fertilized. So I think this is an egg quality issue. But don't worry, we have an egg bank here at the clinic. Mm-hmm. And I was devastated, not because, I was still grappling with this idea that I was going to bring back my father, but I also, too, just felt like it was very quick to sort of turn to this alternative way of having a family, which I was never against. I just was like, it felt too soon. And this doctor's like, well, I'm happy to do is it called dual stim, where like we stim you and also do like using an egg donor at the same time, because then at least, we can guarantee that maybe we get a couple embryos. And I started to look into like research on all this, and I realized that like doctor stats, right, are reported. So it seemed as if I'm not, and again, I don't know enough to speak on this with authority, but it felt like I was being rushed to be a success stat as opposed to exploring why the round didn't work, what's going on with my body. It was just immediate, like 1 round of failed IVF, have an egg donor.
We all have our thoughts on things.
Yes.
And it doesn't matter if it's right or not. That was what you thought. And there might be some truth.
Yes. And I just felt like this isn't the right fit. So then a couple of months go by and I start doing a ton of research. I had a lot of friends who were also kind of going through the fertility, their own fertility challenges. And they were like, have you started taking these supplements? And then I heard about CoQ10 and DHEA and, gosh, I mean, there's like a plethora of them that I feel like everyone was like, have you tried this? Have you tried that? I went to a woman who told me that I had, she had to like do an energetic untying of my uterine wall because there was a blockage, and I paid her like $350 to over Zoom untie my uterine wall. I don't even know what that means. It was all a hoax, but I was looking so desperately for any type of answer as to like, why didn't this work? Like, why didn't my body want to produce eggs? Like, do I not have any left in me that are potentially usable? My husband also, too, I should say, got tested, and his sperm came back. His numbers were all fine. So it was like very clearly me. And that put such a damper and cloud on me where I was like immediately felt broken.
Yeah. And I think that's so common. And that's the sad part of fertility as a business, where it is a business and there are truths to how supplements and energetics of the womb and whatever have, like, they all play a role. But,
Yes.
like, we have to be really protective of our heart and our energy and our pocketbook when we're going through this, because we're particularly vulnerable.
Yes.
And sometimes when we get too, speedy in it, or the emotions are driving, then we are apt to make impulsive decisions that we regret or that cost a lot of money. And so there's a business for that.
Yes. And I then so then I immediately felt like my gut was telling me this isn't the right match. Like this guy does not care about me as a patient. He is looking at me as a statistic. I have to move on. So I went to a different doctor who was very kind and wonderful. And she was like, I don't know why he would have told you that. Still not Dr. Beck, by the way. I'm going to get back to her because she is the reason I have a child. But I went to this other doctor who was very sweet, very kind, but also the same thing, sort of didn't do any research on my body, just sort of was like, okay, your next period, come in. And I did. And she put me on a different protocol, like a different stimming protocol. And I will say it stimmed me quite well. I had like, 12 to 13 follicles, and I got out 9 eggs. And 5 of them ended up fertilizing. And then we did a 3-day transfer. And they put 2 inside of me at day 3. And I ended up getting pregnant. But of course they were untested embryos. I got pregnant. I was like, oh my gosh, it worked. Okay, I was right. And then of course they grew out the other, I think it was a 5 blastocysts. They grew out the other 3 and they did not reach the blastocyst stage. But they had put the 2 best looking ones inside of me. So I thought, okay, at my age, at 39, statistically speaking, you do all this research, 1 out of every 10 is going to be viable. So one of these has to be the viable one. And I ended up, I think I got to about 6.5, almost 7 weeks. And then I miscarried again. And my HCG levels rose, but never I don't even think they got over 200. And then they were like, you're going to miscarry, come back. And if you don't end up, miscarrying yourself, then we'll have to do a DNC. And I was just devastated again because I was like, okay, this is more information that like my eggs potentially are not good. And I was just wildly, wildly sad. I feel like I sound like a crazy person because then I went to a new doctor.
No, this is so common.
Is it? Okay, good.
And I love that you're sharing these things that are so relatable and so common, because it gives the listeners the perspective that I have as a practitioner. Remember, I'm sure I've said to you, oh, Sarah, I wish you could be invisible and hang on my shoulder and go with me on the room to room to room to room, because then you would get the perspective that, no, you are not a crazy person, that all of you are telling me the same kinds of things.
Right.
That's why I made this podcast, because I want these leading doctors to be available, and I want the patients to share their experiences and not to show that it's such a negative experience, but just to show we are all kind of in this together, and I'm trying to normalize what's happening so that women can become more empowered and make better decisions, to not rush these things, to understand that if they slow down, they'll get messages from their intuition, or that will guide and inform their decision
Yes.
making, and they might get other information from a perspective of a more calm nervous system.
Yes. Because I think that I did not have prior to meeting you, which is like so sad that it took me 2 years to
Well, it
even
was
get to
a
you.
really hyped up time.
It was. And this all happened still during 2020. That last round of IVF that I did where I got pregnant, that was in September of 2020. And so I remember January 2021, I really loved that particular doctor, but she wanted to do another round and not change anything. And I said, I don't want to do that. Clearly, this isn't right. I started to do more and more research. And I found that there are certain embryologist labs or embryology labs. Are they called embryology labs? There are labs that the lab really does matter. And so I found a different doctor, which was outside of Los Angeles. And I was like, okay, January 2021, it's a new year. Again, still the protocol is still COVID lockdown. There's no vaccine. There's nothing yet. And so I drive down south. I won't say exactly where, but again, feel free to slide into my DMs. I drive down south. I go to this other doctor who looks at all of my lab reports and says, okay, I think you probably got overstimmed last time. Let me give you less medication and see how your how your stimming process works. Because I think you don't need as much, because the truth is, at your age, the lead follicles are going to be the best anyway. So like, let's try and use less meds and see what happens. I go through another round. So this is my third round in January 2021. And I get only 4 eggs, but all 4 fertilize. And they're growing really well. And he's going to, and every day he's contacting me on day 3. And then he contacts me on day 5. And he's like, okay, some of these look like they're about to be blastocysts. I'll call you tomorrow. And then he calls me the next day and he goes, none of them became blastocysts. And I was devastated. But things were happening during this round that I started to question. I remember thinking, oh, he let my follicles grow to size 26. And I remember reading online that if you get past a certain point, they kind of almost, they're overripened, right? Just like any type of egg, they became overripe. And he let all 4 grow past 24, is it millimeters?
Mm-hmm.
Yes, 24 millimeters. And then I found out again that I didn't have any blastocysts. And this is now 3 rounds of IVF later, and I am devastated. And I call one of my best friends, and I'm hysterical. And she said, have you heard of the SEED program? And I go, no, what's the SEED program? And she goes, this woman, Dr. Danica Thornberry, she's a genius. And she goes, I started doing the SEED program, and it ended up, I did a round of IVF, and I got a healthy embryo after 7 years of just failed fertility challenges. And so I went to your website. I immediately joined the SEED program. And I remember there was a way that you and I could connect. And so I think I emailed you and I said, is there any way we could speak?
Mm-hmm.
And then you scheduled an appointment with me very quickly, which I'm so grateful for, because I think in my email to you, I was like, I'm desperate. And I will say, and I'm sorry that I'm all over the place here, but looking back on this, I have a 20-day-old baby right now. So if I'm a little out of it, that's why. I remember looking back, I was so depressed. And after every round of IVF, I always prided myself on, I not prided myself, but I was always sort of an optimistic, upbeat person. And I would have suicidal ideations after these failed rounds of IVF. Like, I remember thinking, well, if I'm not going to have the life I want, then what's the point in living? And this life I wanted was having this child, to complete this nuclear family that I thought was so important. And it was really dark, and I would get really dark. And I remember my husband, he wasn't on the fence about having kids, but he was like, if it works, great. And if it doesn't, that's okay too. We have each other.
He was a little more detached because he wasn't injecting any hormones.
Yes.
This is an important interjection.
Yes.
The hormones affect our moods and our feelings and our brain, and how we feel affects our heart and our nervous system and our fertility and our choices.
Right.
So it's hard to separate medicine, fertility medicine, and the idea of I'm injecting hormones from the reality of the situation of what that actually means and what it looks like and how it affects you. It can lead to dark, and it was a super dark time
Yes.
for humans. But as my discussion with Dr. Mars was relating to this research study, the little data I collected during the quarantine before the vaccines, the effect of COVID stress on fertility patients.
Right.
And there was a smattering of different things that we were seeing. It was poor egg count,
Yes,
the uterine lining to not proliferate, cycles being stopped, and ovarian cysts were being created. And the worst of all was the miscarriage of normal embryos. And all of that was related to, well, we're thinking the stress, but then we throw hormones in there and it's like fuel on a fire.
it was
In a very vulnerable population. So you don't really know all of this when you're the individual who's going through it. We're in the caregivers here. We're in this really uncomfortable but important position of seeing what's going on for everybody, but unable to stop them from going down that path because you're the only one that's in your body. And so we can try different things. We definitely try herbs and acupuncture. The seed program exists, and foods and meditations and Zoom calls. But at the end of the day, it's happening to you, and it can have this rippling out effect into your relationships.
And it was hard also because we were all so distanced, right? Like there was like this self
divided and isolated.
Yes.
It's a breeding ground for a lot of PTSD to happen.
Completely.
And neuroses.
Yes. And so I think once I kind of processed that, all right, this is probably the fertility drugs, and meeting you, I remember we got on the Zoom. And I think when you and I Zoomed, it was the first time I had hope. And I didn't know what my path towards motherhood was going to look like, but that I was going to get on a path, and that the path was going to be positive, and that it was going to be educational, and I was going to get to explore the emotional side of what it is I was even striving for, because that was really difficult. I kind of lost what I was even doing it for because I was just on drugs after drug after drug. And I think you were even like, okay, we need to get back to sort of ground zero and figure out, what's happening with your body. And up until that point, I'd just been going and seeing these doctors who, again, were just sort of doing this one size fits all medicine where they were like, this works for people, let's try this. And you basically encouraged me to return back to Dr. Beck. And I remember I wrote her this email and I was like, dear Dr. Beck, like, I'm sorry. I was so impatient when we first worked together, and now I want to come back, and I want to do whatever you think, you need to do. Like, I want to, like, you're the scientist, I'm the patient. I won't second guess or question anything. And she was very kind and was like, yeah, just come back. Like, what? And I then kind of got back into the rhythm with, I started seeing you once a week. I would come, it would be my Sunday ritual. I would come to you. I would cry to you for about 20 to 25 minutes prior. And then you would needle me. And I remember I would like lie in the room in your rooms. And I would get these, I don't want to say they're visions, but it would be like little senses of like, you're where you're supposed to be. And it brought me like such calm and joy and working with you and getting to know you. And also, too, I would see people come in and I would hear their stories. I read your book. You would talk to me about other patients, obviously without naming names, but who had had similar journeys. And it just gave me a sense of hope that I didn't have. But listen, I have to say, there was still a part of me that every time I sat in or laid down on one of your tables or went and saw Dr. Beck felt like, yeah, but it's not going to happen for me. It's not going to be my story. Like, I'm going to be the one that this doesn't happen for.
I wonder where that comes from.
I think I think I kind of know now because I've been doing a lot of therapy.
So I want to just say
Yeah.
this process is transformative.
Yes.
The whole fertility journey. And once you insert consciousness in, then it's a conscious, spiritual, personal development journey, a.k.a. transformation.
Right.
It transforms us for better or for worse.
Yeah.
If you make the choice.
And, you helped kind of guide me here to the place where I realized that, when I was 13, my dad dropped dead. So I was a person that bad things happened to, and I became the person that people felt bad for. And, I had so many people along this journey, on my journey to motherhood, say to me, oh, I just so want this for you so badly. And I felt like that pity, that they were pitying me. And it reminded me so much of when I was 13, I was the only person I knew who had a dead parent. So I felt it was really reminiscent of how I felt back then. And I couldn't connect the two until I was, I think, a year into our work together. And the beauty of Dr. Beck is she really wanted to understand what was happening in my body. And I was like, but I've got a time clock. And I remember going to her that first appointment back with all of my 3 failed rounds of IVF. And she looked at each round and was like, well, this isn't right at all. She's like, for somebody your age, the way in which you're stimming, the size they let the follicles get to when they extracted the eggs, none of this scientifically would have worked. And I felt like, whatever you need to do at this point, like, I'm here, like, I'm going to surrender now because I have to. Like, I had to get to the place of surrendering. And it wasn't giving up. It was just that, like, trust that if this was going to work, it's going to work. And if it doesn't, then I would have to make decisions about how, if I wanted to pivot to have a family in different ways. And I talked to so many of my friends, who had, who'd used egg donors, who'd used sperm donors, who had used surrogates, which I ended up using and we'll get to. And I remember hearing their stories, and I remember looking at their children. I was like, yeah, those are their kids. Like, there's no, it started to make sense to me that it was like, there's no clear path to motherhood. There's no clear path to starting a family.
There's no better way or right way or something like it. When it is done and that's your kid, then that's the kid you're raising.
Yes.
And that's your fate.
And when they hand you a child, you're like, this is mine. Like, you know what I mean? Like, no one else is like coming in to be like, wait a minute, I'm going to, that's my kid. It's like, nope, and I experienced this after my daughter was born, when they like wheeled us into the room 45 minutes after her birth and like swaddled her, showed me how to feed her. And they're like, best of luck, see ya. And I was like, where are you going? You can't leave her with us. But I think once I finally got to the place where I was like, okay, I'm no longer on my timeline. I, for better or worse, I'm on my future child's timeline. And understanding that I don't get to choose. It's not up to me. And that, I struggle. I'm not a religious person, but I do believe that everything happens sort of for a reason. But that's also challenged, right? With all the things happening in the world, it's hard to make sense of like the destruction and the sadness and the things that are happening right now even. Is there a reason for all of that? Like, it's impossible to say. Like,
yeah, it doesn't seem logical,
but
it is unfolding destiny. And we do see things from the history repeating in the present moment. And we have to believe that it ends up leading us somewhere better.
Yes.
But so hard to see that when you're in the muck.
Completely. And I don't want to compare like the chaos and tragedy in the world to my fertility journey, but I was in like hell. And ultimately it led me to this place where I was like, it got better and I was healthier and mentally in a mindset where I think having a child was no longer about fulfilling myself, but actually like, I'm going to bring a person into this world and it's my job to cater to her needs, and she's her own person and she's not a part of me, she's not this like extension of me, that she gets to be her own individual.
So, I call that phase of the process cultivating the spirit of a mother. And it's where you as the patient get beyond yourself and beyond the hurt into this ability to see your ways of nurturing other people, which I mean, this is a really good time for me to throw in our funny story.
Yes, please.
Our funny uniting story.
Yes.
Because set the stage. It was, do you know where?
Of course, when we were
Yeah,
rocking around the neighborhood.
Yeah, so I think that would have been 2021 or 2.
Yep.
And my daughter at like 14 years old is manning the front desk, and she has permission to go to the local coffee house and pick up a snack for us. So she's ordered it and she's going to pick it up.
Yeah.
And she comes walking back. So now you are in treatment room 2. You and I are talking.
Yes.
And I said, smells like smoke. And you were like, yeah. And I said, gosh, that guy is cooking his food for the little cafe and burning something, obviously. Now, I've got somebody back in room 3, another patient who's soon to arrive.
Yes.
And I'm just kind of waiting to hear my 14-year-old come back and put stuff on the front desk so that I know she's safe. And my inner voice is saying, stay in this room. Do not walk out. Don't leave Sarah. Don't go and investigate where the smoke smell's coming from. And we kind of were looking at each other like something is off. And then it's like something prompts me, now it's time. And I step out and Kira comes running in. Or no, she's knocking on the door.
Right.
Mommy, somebody's walking down the street wearing my rabbit backpack. And I was like, what? And so I run, I look at the front desk and there's cigarette ashes at the front desk. I yank the needles from room 3. The other patient shows up. Luckily, you didn't have needles, but we realized somebody had come in and robbed my office.
They took your computer.
They took my
purse,
laptop, my phone,
yes.
my keys, my wallet, Kira's backpack.
Yes.
And everything was in the laptop.
Yep.
And phone, obviously, right?
Yes.
And so you, me, my other patient, and Kira, we go running down the street and like we have no idea which way to go, except Kira had seen her sort of going.
Well, and remember,
west.
you had Find Your Phone attached to
Kira's.
Yeah.
And so we got smart. We got Kira to find the location, and we were able to find the woman. I don't know, like
she was found. Remember, she went into a backyard of some random person's house. We are standing on this person's lawn. Do you remember the craziest part?
Yes, where the owner of the home walks out and says, "Are you Danica?"
Yes. Because they were expecting somebody was coming to do her makeup named Danica. And we're like, yes, we're Danica. And they thought we were crazy.
You have my stuff in your house.
You were like, there's a woman in your backyard who has all our stuff. And that woman looked at us like we were crazy.
Yeah, but remember, we tracked her with the tracker, and then we called her.
Yes.
And she answered, and we talked. And then she hung up on us and called us back with FaceTime.
Yep.
And that's how we saw the location of where she was in the back of which particular house with the trim.
With the trim.
Like, I mean, we must have been crazy, but some force came through.
Yeah.
We got the neighborhood watch, like we and the neighbors got the stuff back before the cops arrived, pretty much.
I know. That was it was one of the wildest experiences, but it was trust, right? We followed the path, and then we ended up, of course, getting the stuff back. And obviously, like, the whole thing was so wild, though, because of the timing of it all working out, too. And we just were together until we got all of your belongings back.
Yeah, and I was breaking in new shoes. So I'm running down San Vicente barefoot.
That's right.
We're like just driven on this path. And that is kind of what fertility is like,
really
right?
true.
Like all logic goes out the window, and you're just in pursuit of the thing.
What a journey.
Only in Los Angeles.
Only in Los Angeles.
It feeds well into the story of this whole thing that gets kind of crazy, right?
Yes. And perseverance. We weren't just like, well, the stuff is gone. We were like, nope, we're going to go and we're going to find it, and we're going to get it back, and we're going to track it, and we're going to locate it, and we're going to knock on people's doors, and we're going to get what we want.
Yeah. We're going after it.
Yes.
Yeah. But the other woman who had come in, she has a baby girl who is now 5 or 6. through the work and the seed program and Dr. Beck.
Oh,
and so
gosh.
It was like, okay, we know how to
We
go
know how,
after
yes,
stuff.
and that we're all connected in a way. I mean, I just, it was so crazy because I remember when all that was going down, I think I was about to start my round of an IVF again. Like I was going to do IVF again with Dr. Beck. And the thing about Dr. Beck that is incredible is that she really did spend time on my body and like really kind of explored it. And she said, okay, let's do a round. So I go into my 4th round of IVF, and she was very adamant that she's like the lead follicle. And I'm not going to be scientific. I'm sure she would like.
So far, you're doing great.
Okay, great. So the lead follicle is usually the follicle that produces the healthiest egg. And she said, based on like my body chemistry or however it is made up, that you need to trigger early because they can over ripen really quickly. And so she, as opposed to the last doctor who let me grow to 24 to 27 millimeters, she was like, the second you get to 16 or 17, I'm going to trigger you. And I got really sad because I had all these other little follicles behind that I desperately wanted to catch up, and they were growing, but slowly. And I was like, but if we trigger me now, those aren't going to be mature enough. And I'm going to lose all these numbers. Because in my head, I was still so obsessed with the numbers. Only 1 out of 10 is going to be viable. Like only one at that point I was 40. So I was so desperate to like not lose, the numbers. Cause I thought, what if one of those are viable? And Dr. Beck kept repeating something. She's like, it's quality over quantity. It's quality over quantity. And you always hear that saying, it only takes one. And I hated when people said that to me because I was like, yeah, but I'm not getting any. So like, I understand it only takes one, but what if one doesn't stick? What if one doesn't work? What if I can't even get one? And I became so obsessed with this idea that I needed lots. Like I needed to have a lot because a lot of my friends were getting anywhere between 3 to 10 embryos doing IVF, who were even in some of my same age range. And I kept comparing myself. And I know it's like compare and despair, but I couldn't help but compare myself because when you're going on a journey and other people are going on it too, and you're watching it work for other people, it goes back to that, mentality for me where I was like, well, it's not going to happen for me. So for the first time ever, I got a blastocyst with Dr. Beck, and I was over the moon, and I couldn't believe it, and it was so exciting. And then they tested it, and it had an abnormality, and I was devastated again. And that's when Dr. Beck called me and was like, I'm very, very certain that you have endometriosis. And I go, what? Like, first of all, I had painful periods, but nothing that I felt was any different than normal people complaining about their period cramps. And then she kind of explained to me that it kind of is this sort of hidden secret disease that women struggle with. And I remember you and I had talked about it, and you even asked me point blank, do you have endometriosis? I think, because I had some inflammation markers. And I was like, no, I feel like somebody would have diagnosed me with endometriosis. I always regret this because had I just stayed with Dr. Beck and not gone from doctor to doctor to doctor.
Don't forget the quarantine.
And
you didn't make the decision to leave her. The
That's
quarantine
true.
Made the
yes.
decision to go where
had
you
I
could
just
go.
like waited and gone back when California
There was
fertility,
no way for you to
no
know
way
that.
To know.
There was no way for you to know what to do then.
Dr. Beck recommended a handful of doctors. One in particular is Dr. Najat. Am I saying that right? Dr. Najat?
Yeah, Cameron Najat.
Cameron Najat up in Palo Alto. And she was like, and I at this point trusted Dr. Beck so implicitly that she said, would you consider going up there? I'm going to call him for you. I'm going to make a call. And I said, sure. The office called me after Dr. Beck called the office within, I think, 10 minutes. And I made a flight up to Palo Alto for 5 days later. And I just flew up there. And I was like, I remember walking into Dr. Najat's office and his walls are lined with baby photos, just like nothing but baby photos. And I remember he said to me, he's like, these are all women who thought they could not have children. He's like, you're going to send me one of these baby photos.
He also makes a joke that they're all named Cameron.
Oh, really? By the way, I contemplated it. And so I just remember being like, whoa, like, okay, sure. And I remember I still felt a little bit like, all right, but I'm going to be the person that doesn't send you this baby photo. Like, watch me do it. And I got like so devastated and sad about it. And I remember it's really hard because you can't get diagnosed with endometriosis. Like they have to go in and actually like do surgery to see if you have endometriosis. It's a very strange thing where science hasn't quite caught up yet, where you can I think I showed
Well,
signs.
the diagnosis and the treatment are the same.
Yes.
That when they're treating it, they're seeing it, and then pathology confirms it of what they excise from your body.
Completely. And so I basically, he said, I had a cancellation in 6 weeks. Do you want to come back out here? I think this is now July of 2022. He's like, do you want to come out here and have the surgery? And I said, sure. I was like, absolutely. And I will say, in case people don't know, because I was like, he basically was like, okay, I'm going to like enter you now to see if I can move your organs. And I was like, okay, sure. And then all of a sudden, multiple nurses came in because I think like he's very, very methodical and like is like, hey, everyone's here. I'm doing the proper thing. And he basically tried to go into me and move my organs. And he was like, they're really tight. It seems like you probably do have endo. But again, there's no way to really know until they do the surgery. So I booked this surgery. I did all the prep and, it's like scary. I didn't really understand what was going to happen. I knew it was laparoscopic. I knew I was going to have 4 different incisions. And I just remember waking up after the surgery was over. And Dr. Najat is the kindest, most wonderful human. I can't explain it. He just is very calm and like loving and easygoing and is like, we're going to take care of you and you're going to have a baby. And I'm like, okay. So Dr. Najat, I remember I did the surgery. I wake up. He probably had like so many patients that day. So I didn't see him after I woke up. And I remember I turned to the nurse and I was like, did I have endometriosis? And she's like, the doctor's going to call you. And I was like, okay. And then, they're like, okay, you need to now go and, to try and urinate, try and do these things. And I was like so out of it. And I remember they were trying to like get me out and they're like, your husband's coming to pick you up. Don't you want to see your husband? I was like, no, I see him every day. Like, let me just lie in this bed. Like, I don't want to leave yet. And I was also so scared because I was like, what if I didn't have endo? And I think I was like waiting to hear from the doctor. And then I ended up going into the car and Dr. Najat had called Jack, my husband, after the surgery. And I had endo all over my ovaries, my uterus, my cervix, but primarily it was on my ovaries, which is where my eggs were coming from. I also had a uterine septum wall, which was in the exact spot where something like 90% of all implantation happens. And that if even an embryo I had gotten pregnant on my own.
With a normal embryo.
It would have landed shot right out. And you cannot see it unless you do the surgery. Like it was not visible on an ultrasound.
So it was a small divot.
Yes. Mm-hmm. And in an area which it would be impossible for them to see. So when they went in there, I had just a plethora of reasons why I've been having so many fertility challenges. And I remember I talked to Dr. Beck and Dr. Beck was like, this is like, I knew it. I had a hunch and I was right. And it's not even a hunch at this point. Like she's a scientist. Like she knew. She kind of looked at the all the different things I had gone through and was like, I think you have endometriosis. I'm almost positive you do. And I did. And I feel like everyone who she's ever said this to has all turned out to have endometriosis, every single one. So at a certain point, I don't know why people aren't talking about this. No other doctor, not a single, I had been at that point to 3 other doctors. No one had even hinted at endometriosis.
Mm-hmm. That's the struggle right now. Like I can detect it too, having had a laparoscopy now 3 times.
Right.
Once in college, once 2 years before conceiving Kira, and then once in my postmenopausal following exposure to COVID antibodies. And the old, whatever was left that the second lap hadn't got, that was hidden behind my uterus, whatever was remaining was activated for some reason.
Yeah.
But I know a lot about the procedure. I know a lot about the illness. I've created the Holistic Guide to Healing Endo course inside the SEED program that supplies women with a lot of information and 10 expert videoed interviews with Dr. Beck, Dr. Najat, the Orbucks, leaders in the field, so that the women don't have to spend the money to go and have those discussions. They can watch these videos and get a sense, do I have reason to suspect endo enough to try to pursue it with my doctors? And then it tells them what to do to recover from the surgery, what's going on in the surgery, and how to move forward after having surgery if fertility is the goal.
Yes. And I just like this, you, Dr. Beck, Dr. Najat, like you guys changed my life. Also too, if I had not even wanted to pursue fertility after this, I didn't have painful periods anymore. And I didn't realize how painful my periods were. I didn't realize how much pain I was suffering through each month, just thinking that's being a woman.
Yeah. You don't even know like how your face has changed. There were eye circles that you used to have. You don't even have them now.
Well, that's because I also can now, do Botox and use different type of facial products. I'm no longer trying to have a baby. But yes.
Well, I'm just saying, like when we are in pain, it shows up on the face. It shows up in the pelvis.
Yes.
And
I didn't even quite realize that, and you had hinted at it. You had asked me and I was like, no, I definitely don't have endometriosis. Like why? No one had told me up until this point. And I think it wasn't until I started having like fertility challenges that I even started to look into it.
Yep. So Dr. Najat says in his interview, it's not pain that drives him to do this work. It's unexplained infertility.
Yes. And that's kind of how it felt to me, even though in my head, I thought, well, maybe it's still just an egg quality issue. But if I had endometriosis all over my ovaries, like you probably understand this better than I do. I mean, because you're also a doctor. Like it would have impacted me being able to get any healthy eggs out.
Yeah, because the poor eggs were in a firestorm.
Yes.
From the hormone imbalance and the level of inflammation.
Yeah.
Yeah.
So I then basically was like, okay, I'm going to wait. Because I had known about grief and you talked to me about grief, and when our friend Adam had passed away, I remember you talking to me about the impact of grief on fertility. And like I was supposed to maybe do another round and I had to put my dog down that I had had for 14 years. And I thought, you know what? I just need to wait. I just need to wait a little bit because I'm not quite ready. I think that grief will affect me. I remember talking to you about it. I said, at this point, Dr. Beck, Danica, everyone said there's no difference between this month and 3 months from now. There just isn't. And I had to like.
Maybe even better 3 months from now because of how you will heal.
Yep. And then remember, I got pregnant naturally. And I was not trying. And I was like, oh my gosh, I'm pregnant. And that pregnancy, I got all the way up to 8 weeks. And I remember we saw a heartbeat, but the heartbeat was never strong. And in my head, I thought, this is my dog. My dog is coming to me in child form. And she knew I needed this. And again, that's not how grief works. That's not how the circle of life works. I just wanted to attach some sort of meaning to this pregnancy. And I said, and now I had the endo surgery, so everything's perfect. Well, the truth is, I'm still 40 years old, almost 41 at this point. I was like, I ended up, there was another genetic abnormality.
It might have been that you ovulated post-mature.
Yes, post-mature. And Dr. Beck actually figured that out about me, is that my body didn't ovulate until day 16 or 17, which would have been a post-mature.
27 millimeters.
Yes. And so I could get pregnant pretty easily, but I just could not.
So the combination of a post-mature ovulation and the age and the genetics.
Yeah.
In there.
So I had to have a DNC for that pregnancy. And I remember getting, going into my OBGYN, who I love, Dr. Finke, and I got a DNC, and I told him everything I had been through, and he was like, do another round. And I'd always said with Dr. Beck, I had never done IVF post my endometriosis surgery at this point, And my husband and I, though, had to have a real conversation, because at this point I'm going into now round 5. And he said, I don't want to be in this cycle forever. Because like I mentioned earlier, every time it didn't work, I would fall into a depression that was really deep. And he goes, this is not a way to live. And he's like, and it affected our relationship as well, right? Because as supportive as he was, it was really hard to be around. I mean, I was devastated for like anywhere between like 6 weeks to, 2.5, like 3 months. Because I think the hormones, I was also like, coming off of these crazy hormones, and I was just devastated. And every time it didn't work, it felt like I was like grieving all over again. And I said, okay, I just had this endo surgery. What if we do 2 more rounds? And I'm a member of the Writers Guild of America, and the Writers Guild had just come up with this carrot program where, and if anyone's listening and is a part of the Writers Guild, you can have $30,000 towards fertility treatment. So we also had this sort of financial buffer, and I was like, we can do 2 more rounds, like 2 more rounds, and let's see what happens. And then after that, I'd have to have a real conversation about what would my fertility journey look like after that. I started talking to people about what egg donation looks like. I started talking to people about what not having children looked like. I always thought it was part of my life, but as I started to really process like the grief that I was that encompassed me every time this failed, I realized that I was still hadn't processed some of my grief from back when I was 13. So I really threw myself into therapy with Dr. Ivy, who works here with you. Mm-hmm. And I started realizing that I was attaching the two, and she really helped me work on detaching it and having them be two separate journeys and to not conflate them as one. And that helped me in a way that I'll never be able to talk about. Between working with you, working with her, everything here at Well Women, I really found a community that helped me get to a place where I sort of not detached from the outcome, but I was able to see that my whole life wasn't encompassed. My whole life didn't depend on having a child.
Right.
That I was a whole person without
Well, that's why I opened this center and call it Well People Integrative Healing Center, because there's Dr. Ivy on psychology, and then there's Reiki practitioners here, and there's somatic body workers, massage therapists, and acupuncture, because the holistic approach.
Yes.
As Dr. Mars was here and he was talking about, there's what science can do, and then there's what the women can do when they have the team in place.
Yeah.
So you put the pieces together, and then the outcome changed?
The outcome changed. So I am now in a place where I'm going into my 5th IVF cycle. And I just sort of went into it with a sense of peace that I had never felt before, because I was like, okay, I sort of had mentally changed the attachment I had to the outcome. I realized that I had to continue my own personal growth work, and that having a baby wasn't going to complete me in any way. It just was going to be an addition to my life. It wasn't going to make my life. And I went into this 5th cycle with a level of trust in Dr. Beck, in you, in myself, in my marriage. I want to say that Dr. Beck also too, she found something in my husband's blood work, that he ended up actually having a really high white blood cell count. And I don't really know the science behind this. So if anybody is listening and wants to ask their doctor, she noticed it on his last sperm evaluation. And so she put him on antibiotics 7 days prior to my egg retrieval to bring down that white blood cell count. Now, I can't speak to the science behind that. I just know that we tried that going into our 5th cycle for the first time. And she said to me, reminded me as we started the cycle, I am going to go for the lead follicle. I know you want numbers. That's not what we're doing. This is quality over quantity. And I cried every day to her. I would go in. Of course, my eggs were not growing properly. Only like 1 or 2 were going to be like reaching the point of maturity by the time my retrieval date was coming. And I was devastated. I said, this isn't going to work. I need 1 out of 10. And she kept reminding me, no, you don't. No, you don't. It's about 1. It's about getting a healthy embryo. And I said, okay, I do my egg retrieval. I get out 3 eggs. The nurse tells me when I wake up, I start crying. Dr. Beck comes back and she goes, this is good. We got all 3. This is great. This is what we wanted. And I was like, I wanted 10. I need 10 to have 1. And she was like, again, it's about quality over quantity. So 2 fertilize, 1 eventually makes it to blastocyst. And I'm like, the odds are not in my favor. And I remember talking to you. And at that point, you and I had done a Reiki session. I don't know if you want to talk about this or not.
I do.
Okay. So prior to this, we had a Reiki session where you were like, let me do Reiki on you. And I'll let you.
Let me just see what comes forward when I get into your energy field.
Yes.
And we saw some stuff from you, like as a young girl teen, to see some of the stuff that you were really into, like Disney and films.
And I don't want to be, I'm not a creepy Disney adult. I just want to be clear. Just need to say that. But yes, I did love Disney as a child.
It showed me like utility room and like where you hung out as a
Mm-hmm.
child and some very specific details, and like one corner that was seemingly scary for
Yes.
you to be in.
You saw my basement as a child,
Yeah.
which was the place that I was scared of, and it was behind this wall, and you saw it without me ever telling you about that.
Yeah, that was really strange, but not that strange. I mean, but it was very interesting. And then we saw, I'm going to fast track it, but I saw this little towhead blonde girl coming, and you had always been wanting a boy.
Well, I remember I had been told by a psychic I
Oh,
was going
yeah,
to
the
have a boy.
boy with
So
the-
I had
mhm.
always, it wasn't that I desired one. I remember thinking I'm going to have a boy because this
Somebody
woman
told you.
me I was going to.
Yeah, and so I was like, it's a girl, and I see her. She's got blonde hair and blue eyes, and I had never met Jack or seen a photo of him
Yeah.
or anything. I didn't have any idea, and obviously you're not blonde, so it was like,
Yeah.
I don't know. But I could see her, saw her spirit, saw things that she liked and what she's about. And so it was kind of like, okay, Sarah, what are you going to do with this information now? Like, there's been other patients where I have seen it,
Mm-hmm.
and that indeed is who comes through. It's just a muscle that I've cultivated. So I'm always relieved when I see it, because then I know how to help you visualize.
Yes.
Right. So,
So then so the embryo, I remember the embryo had reached the embryo stage, and then it went away for testing. And, normally Dr. Beck would call me with the results, but I remember they got uploaded to the portal probably like very quickly. I happened to be on my phone in that moment. And so I opened them. And that's when I saw that after, I guess it was like 3.5, almost 4 years, I got my first healthy embryo, and then I remember I wrote you right away, and you said, find out the sex. Sex at birth. I want to be clear that I don't know her gender yet, but that when we went, and it was a girl, and it was and you had seen her, and I remember like thinking, oh my gosh, like, okay, like I had this healthy embryo, and I couldn't believe that like my body was even capable after everything I'd been through. And I want to be also clear that like at that point, I didn't need the genetics in order to have a baby. Egg donation's really expensive. We had that 30,000 sort of buffer from the WGA, but like moving forward, I at that point didn't have an attachment anymore to the idea, other than the fact that this could potentially go on to be a healthy child, and that we did it, like that it was possible, and that like the fertility, like, trusting that my fertility journey led me to a place where I was like able to produce this like healthy, normal embryo, both me and my husband. It was life changing. Like I thought, oh my gosh, I can do this. Of course, I then was like, okay, let's implant right away. And I couldn't do that. And we needed to like, start to work on my body. And we started to do these mock cycles to see if my body was capable of actually carrying.
mm-hmm.
And
so like a Receptiva DX.
Yes.
Mm-hmm.
And they sent it to Dr. Hart, is it climate?
Oh, no. So you're talking about the endometrial function test,
Yes,
the EFT.
EFT.
Pathology test of the uterine
Right.
tissue.
And it just kept coming back that
you had the proteins.
I had the proteins.
That would lead to glandular development arrest.
Yes. And I was once again devastated. I remember Dr. Beck called and was pretty honest about like the stats, right? She goes, look, you made this egg at 40. It's genetically healthy, but with your endometriosis, like the odds are not in your favor. Have you considered surrogacy? And I was like, I don't want a surrogate. I at this point have worked so hard. Like I had always envisioned myself carrying. I was like, this is going to be my path. And I was pretty devastated. And then I remember my husband was like, we worked really hard to get this embryo. Let's give it the best shot, And I think at that point I was like, okay, I struggled with this idea of like relinquishing control, because we jokingly talk about Virgos. I'm a Virgo. I love control. I like to control everything. My dishes have to be in the right spot. Like this poor child, like her burp cloths have to be folded a perfect way. I'm just like a crazy person when it comes to this. The idea of trusting a complete stranger to carry my child, I don't know how I'm even going to start that. I remember going to one of my best friend's house and just like sobbing to her. And she was like, this is great. Like the odds are in your favor if you use a surrogate, like one, one that's been medically cleared and tested. And
Meanwhile, I'm thinking, okay, this is perfect because it's
yeah,
going to break you of the
yes,
the illusion that you're in control.
right. So I remember I talked to Dr. Beck and she had talked to me about a couple names. And then she told me that this one woman who was a surrogacy concierge was Marley Steinman, who randomly was my friend from college.
So
And I was
here
like,
we
wait,
have the full circle
yes,
and the reason for this podcast, the Baby Makers, about these connections going on in Los
yes,
Angeles.
completely. And so then I was like, Marley, I knew that she was a fertility therapist, but I didn't realize that she had transitioned and is now doing this type of work of matching. And so I reached out to her and she herself had used a surrogate and I cried to her and she sort of helped ease my fears. And she goes, it's really weird. She's like, you don't even really remember once you go through the whole process, like how they got here. It's like they're just here, which is like what I talked to you about in terms of like the genetics, the way families are families, and like however they come together, you don't really remember how it happened, and then they're just there. So I very much was like, okay, I'm going to trust this. And I remember she sent profiles to me and I didn't quite feel a connection. And reached out to a couple people who'd used surrogates and I was like, how did you know? And they were like, I can't explain it. You're just going to one day be like, that's the person. And I remember a profile came through and I growing up really loved the TV show Beverly Hills 90210. I'm sure if I rewatched it now, it would probably be wildly problematic. But I remember thinking I always wanted to name my little girl Dylan or even boy Dylan. I loved Luke Perry, R.I.P. And I thought, okay. And I remember a surrogate profile came in with a name of another character on the show. And I thought, it's a sign, it's her. And then it moved very quickly. Of course, my husband was like horrified that that's how we chose our surrogate. But I there's also that, her profile seemed great. Like she had delivered healthy children. She had, she worked in the surrogacy world. And I got really excited at this prospect of like working with somebody who really understood what it meant to be a surrogate. She had been a surrogate before. She lived in California. There were all things that I felt really comfortable that I could like go to appointments and I could be a part of it. And then I just sort of surrendered and I said yes. And it was terrifying. And it was terrifying, honestly, all the way up until my daughter was born. Because you just have to, you basically are surrender. You're giving a basically complete stranger complete control over the most precious thing in your life. And it was really challenging for me. But I kept thinking about the work that you and I had done together, where I was like, this isn't about me anymore. This is about her and my daughter's journey. And if this is the way she wants to come into this world, this is the way she's going to come into this world. And it's also happening because we did the transfer and it took. And I remember 5 days later getting the phone call that it worked. And I, at the time it had one embryo. Dr. Beck and I just want to say that we did a second round to try and get a backup because of course, transfers sometimes don't work. And miraculously at 41 and a half, I guess, not miraculously, it's science. Dr. Beck.
Well, and it's not just the Dr. Beck magic. You did all these different things. And so,
and working with you and working with Dr. Ivy, we ended up getting a second embryo that was healthy, that is still on ice. I had this like trust. I was like, I have 2 embryos. I have a healthy surrogate. Let's give this a go. And every step along the way, I remember I was so terrified. When we heard the heartbeat, I was still terrified that the next time it wouldn't be there. When we went to the 20-week appointment, I was terrified that there was going to be something wrong. And every time it ended up being okay. And the thing I remember thinking is that I didn't have to be positive about it. It was happening whether I felt a certain way or not.
That's I was really good.
Yes, because I remember being scared every single time. It's not like suddenly I had this blind optimism. I didn't. I was still terrified every step along the way. But it was working and it was science-based and it was healing-based, spiritual healing-based.
It served a higher purpose.
Yeah.
you had been transformed.
I had been
I mean,
completely.
for sure, you're one of many that's probably got the diagnosis of fertility PTSD.
Yes.
And that's why I'm talking to Ivy. I'm going to interview her,
Right.
and she will have an episode all about that. Because we know we could talk for so many hours about your journey, but at the end of the day, all of the pieces came in to support you to be able to sit in that discomfort.
Yes.
And allow yourself to be transformed by the process.
Completely.
And it's worked out. She's here now.
She's here. And so, yeah, my daughter Dylan was born. And this is something to go back to the very beginning of all this. She was actually born on April 1st. And that's the day that Adam Schlesinger passed away of COVID. And it's really interesting because I remember when I would talk to you about like the people that I would talk to along this journey who had passed on, Adam really wanted my husband to be a father. And I remember that when I would lie in like Dr. Beck's chair or on your table, I would like talk to my father. I would talk to Adam. I would say, hey, I don't know what's supposed to come, but if there's some sort of cosmic connection in all of this, if this is supposed to be, if my child's supposed to come, like help me on this journey. And it was really interesting that like I kind of started this journey right when Adam passed and my daughter was born on the day that he passed. And his parents actually, when my friend called to tell his parents, they were like, Adam's still directing everything, even from wherever he is. And it all felt weirdly cosmically connected. And I think meeting you transformed my life, meeting Dr. Beck, meeting Dr. Ivy, and also just like trusting that like eventually this wasn't really about me, but it was about her path, and that in being on the path to bring her here, I healed myself.
Right. So that now her starting point is with a happy mom instead of a sad mom who's in a dark place.
Yes.
Right?
Very much so.
Sarah, thank you so much for reliving that and connecting the dots and coming full circle and being such a bright light example for the women of like, it gets dark at times.
Yeah.
But all you have to do is keep putting one foot in front of the other.
Yes.
In the direction of healing, whatever healing is going to look like.
Yeah.
May or may not end up with children at the end.
Right.
But the goal is really like put my heart back together.
Yes. And that's what I'm so grateful that I was able to put my heart back together and had nothing to do with finally achieving this goal of bringing a baby into this world. Like I'm so grateful that I met you and that I went on this journey because I think it was more about me healing myself.
And being liberated from what you had always thought was what you needed to do.
Yes.
Kudos to you.
Oh my gosh. Well, I couldn't have done it without you, and I love you.
It's a team.
Yeah.
Love you back. Sarah, thank you again.
Thank you.